Good evening, everyone, and welcome to Sundays with Shawyn. This is Mayor Shawyn Patterson Howard, and we are just happy to be here this week. This week, we have a very important educational update for you. Everyone's been talking about COVID-19 and the virus, and now in the past few weeks, we've been talking a lot about the COVID-19 vaccine and people's concerns, questions, needing more information or the availability and how to get it. And so tonight we are joined by four incredible women, Dr. Yvonne Brown, Dr. Sarah Jameson, Dr. Nicole Harris Hollingsworth, and nurse practitioner Marilyn Douglas. They are here tonight to share information with us. We're going to ask everyone that you just take a moment, that you please take a moment and share this before we really get started. Please share this so that your friends and family can participate and get the education that we're going to be sharing this evening. I believe the information that we will share tonight will go a long way in helping people make decisions and understanding how they want to move when it comes to getting the COVID-19 vaccine. So we're just going to start off with a little bit of information and statistics. So I'm going to ask Malcolm if you can please share on the screen some of our local stats here in the state, the county, and the city. If you can cue that up. And please take a moment to share this platform. So just quick facts about COVID-19 in Mount Vernon. Right now, we have 567 active cases. That means over the past 2 weeks, we have 567 people that we know have tested positive. And when we say active, that means they still have the ability to pass the virus from one person to another. We have 56 new cases as of January 8th. Our 10-day average of cases, new cases, is about 44 cases a day. That's our 10-day average. And so far since March, when we began the count, we have 5,051 cases, 5,051 cases. So again, our cases by zip code are still very proportionate to what we're experiencing in the city of Mount Vernon. 10550 continues to have the highest number of cases, but that is where our largest population lives. 10552 has the second highest number of cases, and then 10553. So 10550, there are about 55% of our population lives in the 10550. So COVID is equally represented across each of our neighborhoods and our zip codes. We have here our daily cases in Mount Vernon. You can see we hit our peak back in April, and we had a very long period from May to about the beginning of October where our cases went down drastically and were pretty flat. But we've seen an increase in October, November, December, January. Right here, you could see it for yourself. Back in October, our numbers tripled. From September, they tripled again, a little bit more than tripled. In November, we've had a little bit slowdown. We didn't triple our numbers in December from November, but there's still a lot of cases. And as of right now, we are at 355 cases for January. Next one, Malcolm. So in New York, we've had over 1.1 million total cases, 31,672 deaths. Westchester, 10,702 active cases, 76, almost 77,000 total cases, and a little more than, well, almost 1,900 deaths, 1,873. In Mount Vernon, as I stated, we have 567 active cases, 5,051 total cases, and 85 deaths year to date, well, since the beginning back in March. As you can see, this is our past 20 days of COVID. We've had a low on Christmas. I don't think many people went to get tested on COVID. That's why the number dropped so low. But you can see the numbers continue to spike after the holidays because we know people are coming together and congregating, spending time with each other. So we went up to 52 after Christmas. We went up again right after New Year's Eve. And we are staying steady right at that 44. Like we said, on average, the last 20 days, our average number has been 44. Our positivity rates based on the Mount Vernon Neighborhood Health Center, our positivity rates have definitely jumped since November. We've seen a high positivity rate the week of Christmas at 6.2% for overall, and a positivity rate, hold on, am I doing that? Total positive. Am I looking at it wrong? Okay, yeah, 6.2 positivity rate overall and a 10% positivity rate for children. And then, of course, the next week after that with the Christmas holidays, our positivity rate dropped a little bit to 5.0 and 8.2 for our kids. And our total overall positivity rate for the last month and a half at the Neighborhood Health Center has been 2.7. We use the Mount Vernon Neighborhood Health Center as our testing site because it is a New York State testing site. They only provide testing there to Mount Vernon residents. We know that Mount Vernon Hospital and a lot of the other urgent care centers test people from other communities, so they don't necessarily cull out the Mount Vernon numbers from other communities. So we use the neighborhood health center as kind of how we benchmark what our numbers are looking like. We still have our Mount Vernon COVID task force. If you have any concerns around compliance and behavior for businesses, for gatherings, social distancing, and lack of protocol, please call 914-665-2626 to report your cares and concerns, and we will have someone go over there and look at it. Also, Mount Vernon Hospital has rapid testing available. They have rapid testing available, and the Neighborhood Health Center has walk-up testing available. You don't need an appointment, and you can make a call to, if you need more information, 699-7200. Just bring a New York State ID when you go there, so they can have your information. And Mount Vernon Hospital, bring your insurance card. And please, everyone, continue to follow protocols. So as I said, I have 4 dynamic women here with us tonight, and I want to give them each just a few moments to introduce themselves. We're going to start off with our Dr. Yvonne Brown. If you could introduce yourself.
Good evening, all, and good evening, ladies. My name is Yvonne Brown. I am a nurse practitioner. I'm almost 30 years in. I'm currently practicing in ICU. I'm an acute care nurse practitioner, and a specialty right now is ICU and critical care.
ICU and critical care. Thank you and welcome, Dr. Brown.
Thank you.
Dr. Jameson, welcome.
Thank you so much. As you said, my name is Dr. Sarah Jameson. I'm an emergency medicine physician who works in the South Bronx. I have for the past 9 years now. I trained at Jacobi and Montefiore Medical Centers and currently work at St. Barnabas Hospital. So I'm pleased to be here with you all tonight. Thank you for having me.
Thank you so much and welcome again. Dr. Hollingsworth, welcome.
Good evening, everyone. Thank you so much, Mayor Patterson Howard, for allowing me to participate. I am the Vice President for Social Determinants of Health for Hackensack Meridian Health System. I've spent just over 30 years working in the public health domain, looking at societal impacts of chronic disease, and really glad to be here to have this conversation this evening.
Thank you so much, Dr. Hollingsworth. And also we have here my sister, family nurse practitioner, Marilyn Douglas. Welcome, Miss Douglas.
Hi, hello everyone. My name is Marilyn Douglas. I'm a family nurse practitioner and director of advanced practice in a large academic medical center in New York City. I practice oncology and hematology. Thank you for having me.
Thank you. So we have a group of very, very qualified women here to discuss COVID-19 vaccine. So I want to just really jump right into it. we see that the COVID numbers are still very high in our area. You know, clearly we're not comparing to Los Angeles and what they're seeing in California right now, but we are still experiencing spikes in our numbers here in New York. Can any of you speak to that? And, you know, what are we doing wrong? What might we do differently? And how do we get this under control?
I'll start. So I think it's important for the viewers to understand what we're dealing with. As of today, if you look on the CDC, which is where we'll constantly refer everyone back to for information so that we have no instances of misinformation, there are more than 22 million cases of COVID-19 within the US, with over 371,000 deaths. And you put up earlier the New York State COVID cases. And we actually had another unfortunate benchmark last week where we had 4,000 unfortunate people die from COVID within a single day. And this is very important because we have to understand that this is not slowing down. It's not slowing down. And why is it not slowing down? Well, because we have not done, as a society, we've not been efficient in keeping ourselves safe and our neighbors safe. We're finding that infections are coming from even within gatherings within a household. So unfortunately, over the holidays, the public thought that if they had an outing within their home, because home is safe, the house is safe, I know who I'm bringing in, that they were safe. They were not in a club. They were not in a crowded restaurant for New Year's. They were at home. We actually saw spikes in cases because of gatherings, because of travel to different states so that we could be with our loved ones, for instance, even though it was against all of the recommendations. We still have large amounts of people that are not wearing face masks, that are not observing social distancing, that are having symptoms and showing up to work. So all of these things are playing into the number of cases not regressing, but actually surging forward and looking more like it was, as far as numbers are concerned, in the early or late spring. So these are some of the reasons why we actually are, you have large weddings, large funerals still happening without mask wearing. You saw what happened at the Capitol. You did not see masks on with these with that mob that invaded the Capitol. These events lead to spreading events. They're bringing this back to their states. So all of these activities are making it difficult to contain infections throughout the country, throughout the world.
You know, I also think that part of the issue is pandemic fatigue, and people are just over it. Away from there being the science, yes, there's the science, but there's also this mindset that I'm just over it. I'm tired of wearing a mask. I want to wear makeup. I want to go out. I just want to live my life, and I'm tired of it. And that's the unfortunate thing. I mean, how do you there's no data for that. There's no experiments for that. This is just human nature. People just want to live. That doesn't, just because you're tired of it and you're over it, doesn't mean it's over. I think we just have to continue to push the agenda of just doing the right thing, wash your hands, social distance, wear your mask, despite that. But I also think that we need to address the psychological condition or conditioning that a pandemic brings, because I think that that's a huge part of the problem. People are just tired. They're just tired. So they're getting sloppy with it.
That's definitely true. And you hear that over and over again. I know when we gave our state of emergency back on March 16th, and we spoke to businesses and we spoke to people and we spoke to school superintendents, we were saying, 2 to 3 weeks, maybe a month. And, here we are now almost 10 months in, and we still don't have an idea really when this is going to let up. And one of the biggest concerns that I have is we're talking about the vaccine and we're going to jump into that in a second, but people feel like, okay, this vaccine is coming and by the time the summer comes, our lives are going to go back to normal. And that's just something I don't believe at all. I don't think that we're going to see this slow down really until the beginning of next year. The amount of time it's going to take people to get vaccinated and for the vaccine to take place, and the people who have hesitancy around being vaccinated. So I think we have a much longer road than many people expect, and we have to find a way to deal with pandemic fatigue and the mental and emotional and social issues that are connected to it, because it's very real.
Mm-hmm.
So let's jump right into it. Let's talk about the vaccine. The vaccine is out. Pfizer has been approved, Moderna has been approved, AstraZeneca and others are in the process of approval. We see that they are being released now to the hospitals, and the hospitals are beginning to vaccinate. Last week, we saw Governor Cuomo talk about vaccination rates in different hospitals throughout the state. Here in Mount Vernon, we had the lowest vaccination rate of any of the hospitals who would receive vaccine in the state. It was 11%. So when they talk about a vaccination rate, they talk about based on the number of doses they've given to a hospital and the percentage of doses that have been given out. So Mount Vernon Hospital, I believe, had about 500, and 11% was giving out on the day that the governor spoke about that. New Rochelle Hospital had about 22%. So can we talk about the vaccination rollout and what have been some of the challenges to the vaccination rollout, not just in New York, but as you've also heard across the country?
Okay.
So there have been a number of challenges as it relates to the rollout, because initially it was very confusing for people to understand like where they fell. There has been a tiering of that rollout. So group 1, group 2, and group 3, with group 1 being essential personnel that had direct contact with patients. When this vaccine was rolled out, regardless of state, regardless of region, those individuals who were receiving those first shots, for so many people, they were like, well, I want to see what happens with them before I make a decision on whether or not I'm going to get the shot. And that hesitancy, in so many ways, sort of both was encouraging, because it meant that people were thinking about should they get the shot or not, but it was also, it created an opportunity for people to say, I got it, see that I'm doing okay, I'm doing well with this, and then to continue to move forward. As this rollout continues to progress and additional groups are approved to be vaccinated. In group 1A, seniors living in congregate facilities, nursing homes, et cetera, were improved. And in those groupings, you actually saw good adherence. Now, as additional healthcare providers within the health systems get approved to continue those vaccinations, as there is the expansion, as the governor has over the last several days had a change of mind around how the vaccine should be distributed across the state, I believe that you're going to see increased receptivity toward having the vaccination.
Thank you. Anyone else around vaccine rollout?
I think it's a bit disappointing in how it was, the low percentage that we've heard about from the governor last week. But I think we'll start to see a ramp up of that for obvious reasons. We're also doing a lot of addressing of healthcare workers and educating healthcare workers so that we can improve the rate of vaccination for the frontline workers. So that's another part of this, is even educating the nurses and the techs and the housekeeper, everyone that's involved in healthcare that has to, that's directly involved with patient access and rooms, et cetera, educating them and what this forum is all about. There are myths, and some of the myths, unfortunately, even touch healthcare workers. So we do have to improve in that area also. Town halls, informationals, hospital by hospitals, health center by health center, et cetera. Very necessary so that we can maximize vaccinations amongst those that are most exposed.
Absolutely. I mean, I think with anything new, there is definitely a hesitancy. There is a wait and see attitude. There are a lot of people who have been waiting for the vaccine. They've been waiting for the vaccine. And so in different places, you see people standing online. They're waiting to get the vaccine. They're very anxious. They want to make sure that they're some of the first in line. And then there are other people, like you said, even healthcare professionals that are saying, look, I want to see how this works out. If there's a 2.0 version, maybe I'll be in that group. I have some concerns. And then there are some people who are absolutely dead set against getting the vaccine because they have issues of trust. Some people just don't believe in vaccinations at all. Other people do not trust the speed in which it was created. So Dr. Jameson, if you can kind of speak to us about some of people's hesitancy and why there are some people who might be mistrustful of this, and even talk about the systemic racism that has been involved in the whole discussion around COVID and now the COVID vaccines. Can you speak to those issues?
Absolutely. So when it comes to vaccinations and the hesitancy that we see, particularly in the Black community surrounding getting the vaccine, we know that it's due to the history of medical racism that we've seen in our country, unfortunately. I know with the administration of the vaccine, there's been a lot of talk or reference to the Tuskegee Project and Henrietta Lacks and a lot of disparities and, like I said, medical racism that we've seen in the history of medicine. It goes even further back than that. I don't know if you all are familiar with Dr. J. Marion Sims. He's the father of modern day gynecology, and he was able to pioneer lots of surgical procedures by using enslaved Black women without any anesthesia in a very inhumane way. And so when we have a history of these awful things happening to us as a people all throughout history, it's no surprise, it's nothing unexpected that when we are now in the age where we have a brand new disease, but then also a brand new vaccine, of course, we would have some reservations about signing up for it. I mean, during this pandemic alone, we have seen so many disparities, and we've seen so many incongruous things happen in the Black community with regard to COVID. And so the same way we were disproportionately affected by COVID, I know that we assume that we would be disproportionately affected by any side effects, for example, that come along with the vaccine. And so to answer your question, I think the hesitancy comes from our unfortunate history when it comes to medical apartheid, is what it's called, within our country. And so it's something that is unfortunately alive and well today.
Right. And following up on Dr. Jameson's comments, it's something that's not just impacting Black communities. It's something that's also found in Indigenous communities and Latinx communities and in so many communities of color across the region, which you can find all of those populations living here in the city of Mount Vernon. And so it's not any one of our story, it's all of our stories, which gives all of us a pause. And as we're making the choice to adapt and adopt these new procedures, we're all looking at this from the elements of our history where there has been historical mistrust. However, I'm always cognizant of needing to understand the history of that mistrust, but then also embrace what's required around moving forward. Because the same way that we've heard mistrust and systemic racism, which is accurate, related to concerns about these conditions, we are also hearing a number of other myths, as Ms. Douglas brought up, about mask wearing, about hand washing, about the causes of this condition. And we need to make sure that we're balancing out, our mistrust with information that will help keep us healthy.
I think in addition to the historical trust issue, of research in the past. There is also, particularly healthcare workers and nurses and doctors, who are witnessing the disparity in the treatment and how poorly African Americans, Blacks and Browns do with respect to COVID-19. So I'm a healthcare worker, and I am working on a medicine unit, and I see patients come in and out, and I see certain groups of patients that just do poorly. Because they do poorly, because they have comorbid illnesses, or because they're just not receiving the treatment that others are. So behind that, after we watch this play out, then behind that comes the vaccination for these frontline workers. And perhaps there's not necessarily a forum of education for them to discuss this. So now I watch this play out, and now I'm first in line to get a vaccination without the benefit of an in-depth conversation with someone about what I've seen, what I've experienced, and what I know to be true. I've watched it. I've watched the disparity in the treatment. I've watched the clinical trials. I've watched who got it, who didn't. And now I must now line up and, raise my hand and take a step forward for a vaccination without necessarily being a forum or a place for me to get information and also to voice that.
And, I think that we have to also address, even at the highest levels of government, we've seen misinformation. And we've seen, a president speak to really odd and unusual and terrible alternatives to the vaccine, bleach and et cetera. And that causes distrust. That causes distrust in the community. And, all of the changes in time frame for the rollout of the vaccine, which was very largely pushed by political agenda. Oh, it's going to be here by September. And then, it's going to be here, before the election. And that was not necessarily scientifically true. It was what he was promoting for his own benefit for the elections. The scientists were always saying, I don't think so. We're still working on this. But, he had an overpowering voice to the community in saying that the vaccine will be out much sooner than the scientific community was giving data to.
So that's one of the concerns. So some of the questions that we have being presented here online tonight is we were told the vaccine wasn't going to come out for 18 to 24 months. And here it is approved out and, people getting shots 10 months into this virus. And so there's a lot of mistrust around the rapid release and turnaround and whether or not, we say the efficacy rate is 95%, but do we know what the real side effects are and how this is going to impact people down the line? And so there is a lot of concern about not only what we know, but what we may not know because this happened so quickly. Can someone please speak to the rapid release of the vaccination and people's mistrust of that, and as well as it being done under Trump? And what's interesting is, like you said, it's not just Black and Brown communities that are concerned. Now you have a lot of Trump followers saying that they don't trust the vaccine. They don't trust the vaccine because, maybe Trump didn't control the testing as much as he should have. So we know right now that people who are disenfranchised, whether you're Black, Brown, whether you're of a certain religious background, whether you are poor or impoverished, whether you're blue or you're red in your political beliefs, that people who are disenfranchised or feel disenfranchised are less likely to consider being in the first round of vaccinations. So we can talk about the speed in which the vaccine was released and then some of the side effects that people are talking about that have a lot of people concerned. Someone said there was a doctor that died 2 weeks after getting the second dose. So if we can have that part of the conversation now would be great.
Well, can I just say, just to address some of the, I guess, political conflict when it comes to this vaccine. I think we as a country need to remember that we are not the only country going through the pandemic. It's a global issue, right? And so a lot of the mistrust that comes along with oh, the vaccine came under the Trump administration. It came just in time for the election. It came just in time for this person's political agenda. Remember, this is something that the entire world needs. The election is important to us. It's not important to other places where the vaccine has already been released, where they've already tested it, where they've already gone through clinical trials. In England, they rolled out the vaccine sooner than we did. You know, we got it, our country got it relatively late compared to other first world countries. So that's something that we need to remember, that we're not the only ones who are, like I said, receiving the vaccine, receiving it in its newest form. So it's not just us, I guess. And when we keep that in perspective, it will, I guess, maybe temper some of those feelings that this is being somehow politically charged. Two, I guess, to answer the question directly in terms of why it's being rolled out relatively quickly, it's not that the science behind the vaccine was created quickly. That science, which is the mRNA vaccine technology, has been in existence longer than the pandemic. It's just that a lot of the red tape and the politics and the policies that normally take months to years to tease out and to get approved have been lifted because of the emergency that we're in, because of the importance of getting it out. And so that's something else to remember too. I know that's not the complete answer, but that's what I wanted to contribute to it. So if anyone else has anything else to add.
Also, just briefly, that there's been research on the SARS virus already. So there was a fair amount of work already done on SARS before this pandemic.
Yeah, and actually about 30 years worth of work has been done on messenger RNA technology. And, you know, technology advances. So when we start talking about gene technology, it is very well advanced. And messenger RNA technology is used not only in infectious disease, it's actually as part of cancer treatments development. So this is not new science. What basically happens is the foundational medicine already exists. What we needed was some genetic coding from the virus. And that genetic coding is then plugged into the established technology. And then your clinical trials happen. So we were not starting from zero. And very often when a medication is created, it starts from the beginning. And we already had foundational medicine. So messenger RNA is established. We know a lot about it. It's used in other areas. And really, you know, there was concern, what would it do to our DNA? There are some myths about whether or not it causes, you know, various different things, but the actual messenger RNA molecule is extremely fragile. It degrades or breaks down in your body within a couple of days, but it leaves behind very important proteins that our body, our T cells use to make proteins against COVID-19. And that's the basics of how it happens. So yes, it did happen quickly. The clinical trials, I am a part of clinical trials very frequently practicing oncology. And there are times with compassionate use, and because of particular concern, there is, again, that lifting of regulation. It does not mean that it's unsafe though. The red tape is loosened so that we can push through to certain trials, so that we can start looking at not just efficacy or how well something works, but also at safety profiles. And when you're looking at Pfizer had somewhat just about 60,000 participants, and Moderna had about 28,000 participants within this period of time. And the vast majority of these participants were white, but there was representation of African American, Asian, and Hispanic patients. With Pfizer particularly, 70% of their participants were obese, and 20% or so, a little more, had comorbidities. A comorbidity is like hypertension, diabetes, etc. So these were very well researched. And the timing is concerning if you do not know research. But from standing from my position, where I've seen and been a part of clinical trials on the other side, I can certainly see, especially given the gravity of the situation, like Dr. Jameson said, this is a pandemic. It is not going away. Even if we were perfect in what we did as a nation, without vaccination, all we need is a visitor from another country to reintroduce this vaccine. This is something that has to be addressed quickly, because as we said earlier, 4,000 people dying in a single day is a horrible benchmark. So this is how something can be processed through clinical trials in 8 months. But again, we're starting from foundational medicine. This is foundational medicine. Messenger RNA is not new.
And, you know, I mean, one of the factual pieces here is COVID hasn't discriminated insofar as who it reaches: white, black, rich, poor, urban, suburban, rural. It's had an incredible impact on our economy. And so we know that what they said, cash rules everything around me. Look, when the economy gets hit, people get motivated to make sure that we are rescuing the economy. And so if this was a disease of just poor or just black or brown, and it didn't impact the economy, we may not have seen as much motivation. But because it is so widespread, and because it doesn't discriminate, and because it has the potential and has crippled our economy in so many places around the country, there was just much more motivation. And so the dollar screams very loudly, and this is the result that we've seen. Can we talk about some of the side effects that people are hearing about? People are hearing about Bell's palsy, you know, which is a turning and a twisting and a weakening of you know, one side of your face. And so people are afraid of this. This is the one that I hear the most about. So people are talking about Bell's palsy. They're talking about, you know, whether or not this has an impact on women who are pregnant. Should they be taking the vaccine? Can we talk about the side effects and people's concerns?
There will always be side effects to medication. There will always be allergies to medications, to some of the most benign medications. Some people have allergy to Tylenol. So there will always be those side effects. There have been reports of Bell's palsy. There are reports of mild viral symptoms, myalgias, body aches, headaches, some sore throat, fatigue, nausea, and soreness at the site. But most of these side effects are manageable with Tylenol or ibuprofen or nothing, or sometimes just rest. But the number of significant side effects is fairly low. But there will always be adverse events and severe anaphylactic or really shock type allergies to every medication. There are people who are allergic to flu vaccines. So those things will exist, but I don't think those things should deter you from the vaccination, because the incidence is very, very low.
Right. Additionally, individuals are working with their physician to address specific concerns related to side effects that they may encounter. So it's not just, you know, you're going to be online and someone's going to stick you in their arm. There are a number of screeners that occur prior to vaccination, and working. If you and your physician have any specific concerns about vaccination, when you should get it, or things that you need to take into account, that's absolutely a part of care. It's not just going to be you get stuck, and then you get cast to the wind.
Yeah. And you're observed.
Vaccination camaraderie is critical.
Sorry.
Can I also add? I'm sorry. Mayor Patterson Howard mentioned Bell's palsy, which I've seen in the news very often also. And when they actually looked at the numbers of cases of Bell's palsy after having received the vaccine, it seems that the incidence is not any more than the incidence in the general population, meaning that the same amount of people who got Bell's palsy, let's say 0.1% of people who received the vaccine, is representative of the percentage of prevalence of Bell's palsy in the general population at all. So the same 1% that received the COVID vaccine are also the same 1% that did not receive it. So it's more of an incidental finding as opposed to a real causative link between the vaccine and Bell's palsy.
Yeah, and Moderna had about 27,000 participants in their trial with 3 Bell's palsy cases. Just to put this in, you know, like to really just think about this. Does it happen? Yes. It's exactly what Dr. Jameson said, the same frequency as in the general population. You really have to understand what Bell's palsy is a little bit more medically. What is very important for the for the viewing audience today to understand is that we're not giving live virus.
Right.
All right. There's a fragment of the virus that has genetic code. There is no live virus being given. So the reason why one may develop Bell's palsy after receiving any vaccine, because we also see Bell's palsy in flu vaccine, et cetera, is because there is a immune response. And sometimes that can awaken the virus that is actually already with the person, causing the paralysis of that nerve in the face. So it's not as simple as you get the vaccine and the vaccine directly caused Bell's palsy. The other thing to understand is that all of these side effects that you can get if you receive the vaccine are transient, meaning that they go away. And many times it's almost expected. I received the vaccine. I received Pfizer. My second dose is on the 17th. I had a very sore arm. I'll be honest about that, and some fatigue. But there are side effects because your immune system is responding to what we are showing it. We're showing it some DNA sequencing of a virus so that it can mount a protein and a response for if it sees it again, and so this is almost expected. That's why some of the side effects actually look like COVID symptoms themselves, fatigue, headache, et cetera, except for the sore arm, which is, it feels a little bit like tetanus shot or flu vaccine, that soreness that you get. I also want to address the impact on pregnant women. Pregnant women were excluded from the trial, but what the CDC and the American College of Obstetrics and Gynecology recommend is that it's made accessible to pregnant women so that they can have an in-depth discussion with their OBGYN to see whether or not they should receive the vaccine. All right, so that's access given, but the decision is made between that pregnant woman and the OBGYN.
Sorry. I've had people ask me questions about, well, we've talked about comorbidities. We've talked about high blood pressure, diabetes, cholesterol, asthma, COPD. We've talked about illnesses like that. But what if you're a person who recently got over cancer? What if you're someone who has MS or HIV, AIDS, or other, cofactors, medical factors that impact your immune system? Is this safe to take then? Because we know that MS is higher in Black and brown communities. We know that there is still a good segment of the population living with suppression and immunocompromised illnesses. So can you speak to those issues?
I don't want to do all the talking. I'm away from my panel. Okay, so in regards to cancer, we can address oncology, and really we can also address the others. We're actually going to see oncology patients vaccinated. What really is important to understand with vaccination is first the discussion between you and your healthcare professional. Because if you're on what we would call like pulse steroids or short-term steroids, it may not allow you to mount the response that we want you to have when you receive the vaccination. But if you're on longer-term therapies, very much so, you can receive the vaccination. But these are individual discussions between that person and their physician. We cannot really globally say, yes, you can receive the vaccine, because we don't know what you're taking for your chronic illness, particularly when you're talking about MS and autoimmune diseases and cancer, because these therapies may include steroids and may include biologics that can more importantly inhibit your ability to mount the response that we want it to mount with those 2 doses of the vaccine. If you've had COVID before, you can certainly get COVID again. We know that. So as long as you're not actively infected, you should receive the vaccine, barring that you do not have some sort of autoimmune disease or cancer. HIV, you certainly can receive the vaccine. Again, they were excluded from the study largely, but the decision is made between the patient and their healthcare provider. That's very important. Even if globally it is said that anyone with a chronic disease should receive the vaccine, That is true, but to the detail of not knowing what you are on as far as therapy is concerned, that is a discussion between you and the healthcare professional.
So, Dr. Hollingsworth, I kind of want to ramp this question up for you and Dr. Brown. John Morrison asked the question, he said, why is it in America did this virus become the black and brown virus? And we've heard things about essential workers, frontline workers, poorer people who are very, very front facing, not being able to get tested, living in close quarters. Can you talk about some of those social determinants of health and how these have maybe caused a greater impact on black and brown and poorer communities?
Sure, I'll definitely start that one. So, when you look at disease or any negative, what's perceived as a negative health condition, those are things that are most impacted by social determinants. And like, what is that? Social determinants is a very fancy way of describing the environment in which people are born, that they live, or like where they work, play, worship, age, and it impacts the way in which your life is going to function, the health outcomes you're going to have, the risks that you're going to experience, and your life quality. And it's very everyday things. How much money do you make? How much school education do you have? How much stress are you under? Did you have a difficult childhood? Do you feel lonely? Are you working or working at the wrong place, which is generating stress? Are you unemployed? What's your social support look like? Do you have access to the basics, food, transportation? Are you addicted, et cetera? And what we know just from lived experience is that when you look at communities of color, LGBTQ plus communities, what you find is the more that you're likely to be poor or work in an inappropriate location that creates exposure, or if you work in an industry that is less safe, that you're more likely to be exposed to this virus. You're more likely to be in those crowded conditions. We know that racial discrimination and violence occur more frequently in communities of color than in other communities. And so as we're looking at these social determinants, there's such a close correlation between communities that are very impacted by the social determinants and higher rates of COVID infection, that the maps effectively lay over each other. Over the last 2 years, there's been a lot of people looking at, the Fair Land Use Acts, what is commonly referred to as redlining. And you look at communities that were redlined for the isolation of what are now communities of color, and you see really, really high rates of COVID infection. So many of these social determinants, which can change over time, but it takes such a long period of time for it to change, that effectively where you find poverty, where you find these social determinant stressors, unfortunately, you're going to find lots of disease.
And going back to some of the concerns that people express, like you said, housing, income, education, density of your neighborhood, whether you're working in a crowded work environment where there may not be good ventilation, and it's very frontward facing, very high contact with the public, just like our first responders, you're going to see higher rates of COVID. When you live in overcrowded housing and apartments, when you have multi-generational families living in close quarters, when you have people doubled up, and even especially as people begin to lose their jobs, more and more people have continuously doubled up. We're seeing, definitely as Marilyn spoke about, Ms. Douglas spoke about earlier, is you're seeing higher rates of infection. It's happening within the household, within the family, within familiar places, not just out in the public. We get the numbers every day here in the city of Mount Vernon, and we get to see every case that is diagnosed for a Mount Vernon resident. And that's where we're really seeing the spread, people in the same households being infected in high numbers because of that close living quarters and conditions. And because when we get home, we tend to put our guard down and we feel very comfortable within our homes, and it puts us at high risk. So the last two questions that we have that we're going to be able to address tonight, and then I want you to give your closing comments, is how many of you have taken the vaccine? Has everyone here taken the vaccine? If
Yes.
Yes.
everyone, okay, so each of you have taken the vaccine. Huh?
You've taken different ones. So some of us have Pfizer and some of us have Moderna.
I've taken
So-
Pfizer.
Who had Pfizer? Raise your hand. Okay, and who had Moderna? Okay, so Pfizer and Moderna. 3 had Pfizer, 1 had Moderna, and all of you received, like you said, minimal side effects, sore arm.
Yeah, nothing.
Sore throat, body aches.
I had fatigue for about a day, fatigue and mild headache, and I experienced that with both doses that I got. Outside of that, nothing else.
I'll
So
tell
you received the second dose? Who's received the second dose?
I received my second dose on Friday, actually.
Okay, so
Yeah.
that was one of the questions. People are concerned about the second dose, that they hear the second dose is a little harder to recover from than the first dose.
I've heard that. I did not experience any worsening of side effects than the first dose. Both doses, I did have a dull headache. I had fatigue for about a day, honestly. But the second time around was no worse than the first.
Okay.
You know, I had COVID in March, and I had a lot of long haul symptoms actually. Sinus type headaches, facial pressure, ear pain, headaches. You know, after I got the first dose of the vaccine, I would have that recurrence maybe every 2 to 3 weeks, and it was short lived, a day or so. After I got the first dose of the vaccine, those symptoms that were recurrent are improved actually. Whether or not it's related, not related, I'm not sure, but I see a significant difference in experiencing those recurring symptoms.
I think that's important. I mean, I'm going to ask you, do you recommend to people to get the vaccine?
Absolutely.
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 Why
Dr.
would you
Jameson,
I want to add something to that. It's not just about getting the vaccine. I think it's important, especially for people in communities of color, to also register for the CDC VRSA tracking related to the vaccine, so that the information about what your responses and what your side effects are related to the vaccine between doses can be tracked and cataloged. You know, part of the challenge to all of this has been there's not enough information. We're not hearing from enough people. The sample sizes aren't large enough in communities of color. So this is, you know, get the vaccine, but also now this is your opportunity to contribute to the data about side effects, because no one controls what gets written in that box but you. You're writing it and they're contacting you every day.
Dr. Jameson, could you tell us a little bit about the dosing for Pfizer versus Moderna, just so that we can make sure to bring that up?
Oh, sure. So before talking about the differences, I guess the similarities in the two, both are mRNA vaccines. And we did speak a little bit about that technology, but they are both the same. They both have the same framework. They are both shown to be very effective. Pfizer, a little more than Moderna. Pfizer had a 95% rate in terms of being effective, whereas Moderna was 94.1. Past that, they have differences in, I guess, storage and distribution. So when it comes to storage, Pfizer needs to be stored in an ultra cold freezer. So the number I saw was -24 degrees Fahrenheit, as opposed to the Moderna, which needs to be stored in a freezer that is as cold as any one of our home freezers, -4 degrees Fahrenheit. Also, what determines which one people may or may not get is really an issue of distribution. So Pfizer's minimum order for an institution, for example, is 975 units. So if you're at a large teaching hospital, for example, or a large academic center, or even a nursing home where there are lots of residents and staff, where they would need to give that many people get them vaccinated, you would more likely get the Pfizer vaccine because the minimum order is just a very, very large order, if that makes sense. Whereas Moderna, the minimum order is 100 units. So if you're at a smaller hospital, for example, where you don't have 975 people to vaccinate, they would more likely order the Moderna just because of the minimum requirement in terms of receiving the vaccine, if that makes sense.
It does, and this is rapid fire because we're really at the end now, and I just want to make sure we get this in. When it came to testing, there was such a high threshold for people to be able to get tested, and one of the things that helped is when they opened up the mass testing sites. Do you think mass vaccination sites like they did for testing, open parking lots with tents are going to be one of the ways that we have to go in order to really roll this vaccine out quickly?
They are absolutely going to occur. What will be key, though, is for individuals returning, at least for now, to the same location. So yes, you're going to see them in parking lots, like on Glen Island in Mount Vernon, like the same types of things. But wherever you go for your first shot, because of the logging, at least for now, you will need to go for your second dose. So it will be key making sure that wherever you get the first one at, that location is accessible for you. But absolutely, that is how it will. That's one of really the only ways it's going to be able to happen.
I just want to say that you cannot mix the doses. You cannot start with Pfizer and end with Moderna. That's important too.
Exactly. Yeah. And do you expect this to be an annual occurrence? Will people have to get this like an annual flu shot? Is this going to be an annual shot, or what are we thinking?
I don't know if it will be annual. I do know, at least for right now, it is not mandatory. So there is still elements of choice on whether or not people can get it. There isn't a regulation in place saying that you must get the vaccination, but I don't know if it will be annualized.
I think long-term immunity has to be determined first.
Right. We do not know what long-term immunity looks like. How long we'll be able to hold on to the antibody. We do not know yet.
I mean, I know that I tested positive for the antibodies back in May. I still have some, but I don't know how effective they are. And right now I'm not an essential worker at that level to even go get a vaccine. But that's why I'm making sure I educate myself and others so that when it is time for people who are eligible, that they can make that decision. And I think that's very important. It's great to see stars and electeds get them, or people of influence. But at the end of the day, people need the proper information so they can determine what their course of action can be. So we have about 3 minutes left. If each of you can just give your closing comments, I want to thank you for coming on. And I just want to, we have an excellent panel here of experts. Dr. Sarah Jameson, congratulations. You were named as an essential worker in Essence Magazine back in this summer for the work that you did in St. Barnabas ER. So we have an incredible group of professionals here with expert information. And like people are already saying in the comments, this is the most information they've received to date. And hopefully we can come back together if need be and give people an update when we maybe get another month into this. So closing remarks, and we'll start off with Dr. Brown, then Dr. Jameson, then Marilyn Douglas, and then Dr. Hollingsworth.
Well, thank you. This has been wonderful. Thank you for having me. Unfortunately, sometimes being African-American or Black and Brown is a comorbidity of sorts sometimes. So it's important to have these forums that we can educate our community. Secondly, I want to say something about the vaccine. Research is necessary. I do understand having reservations. I had reservations. It was my plan to wait to see how my demographic did as well. But research is necessary. And I think that ultimately your reasons are your reasons. But it is important for us to be a part of the process and not sit back on the sidelines. It's necessary. So thank you for having me. I appreciate it.
Thank you.
Absolutely. I just also want to piggyback off of that, say thank you for having me as well. I want to thank the viewers who took time out to sit and listen to such an important topic. I think that's very responsible of you all. I also just want to encourage everybody to educate themselves about these topics. And when I say educate yourself, I don't mean go on Facebook or YouTube. Excuse me. This is very informational via Facebook, but in general, if you're looking for just non-biased information, your best bet is to go to the CDC's website, the World Health Organization's website, very reputable sources, so that way you are getting unbiased and accurate information. And that's all I want to say.
Yeah, definitely use your sites that will be unbiased and transparent with the information. The CDC is loaded with information. We are in unprecedented times, and we have to really remember. I know that we're fatigued. I know that we're tired, but we have to do what we have to do to get to that new normal that we really want to see again. And it's going to take the vaccine. Again, this is a pandemic. This is worldwide. This is not Mount Vernon. This is not New York State. This is the world. And if you have concerns about the vaccine, ask questions and get answers. But the conspiracy theorists are not the place to go.
Hi. Well, thank you guys again for allowing me to participate in this process. I just want to remind everyone that the decision in this is yours. I'd recommend getting vaccinated, but if you choose to delay or even to refuse, do it making sure that you get all of the information. Regardless of anything else, work hard to stop the spread and understand that even if you get the vaccine, that the vaccine protects you, but it doesn't necessarily mean that you can go willy-nilly around anyone else either. You've got to make sure that you protect the unvaccinated. And as everyone else has said, make sure that you go to all of the right websites, the CDC, the FDA, your local health department. And definitely this is a conversation that you're going to need to have with your own individual healthcare provider to make sure this is right for you. So thank you again.
Oh, thank you so much again. So for those, please, even after this video is over, continue to share it. Send links even in text messages to your friends so that they can get this information. Like I said, in another few weeks, if the ladies are available, we will have them back again as we move more into the general public being able to take the vaccine. Also on January 24th, we will do another session here on Facebook with our Westchester County Executive, George Latimer, the Westchester County Department of Health, as well as Mayor, I believe, Noam Brampson. So we'll be doing another session here on Facebook Live. Yeah. On the 21st. Yes, Malcolm just corrected it. So on the 21st, we will be doing another session with our county executives, several mayors throughout the county, and we'll continue to bring you information. This Wednesday, on our Wednesday update, we will have the Vulcans and the Guardians Association. There's a lot of discussion around police reform and improving opportunities in policing and fire service for minority communities. So we will have them on to talk about civil service testing, how you can get on the list, what the requirements are around agility and psychological testing, and what that process looks like. So please join us. And then on next Sunday, we will have Sylvia Boulevard. We'll be here talking about Mayors for Guaranteed Income, as well as our financial navigators and some innovative programs that we're offering here in the city of Mount Vernon to help people in these financially stressful times, to ensure that you have the access to emergency financial assistance if you're a small business, access to capital, and also understand that there are opportunities even in the midst of a pandemic for economic mobility. Take care, everyone. Be blessed. Be encouraged. Stay safe and wear your mask. Keep social distancing and wash your hands. Thank you so much.
Thank you.
Ladies, if you could stay. Ladies, stay for a second. Good night, everyone else.